Hello, planet Earth. Here we are again. I hope you are all safe and healthy in these times. Welcome to our webinar about the post-operative guide. I'm here today with Sonja, who's our post-op coordinator. And I'm Lilia, the community manager for Facialteam, and with over a decade working with the trans community. And I'm also founder of our private peer group here on Facebook, so please join. And I invite all of you to please put comments down here below. Let us know where you're from so that we can say hi. So I'd like to introduce Sonja here a little bit before she begins talking about our aftercare systems. And she has been with Facialteam for 4 years, beginning as a patient coordinator. And Sonja is originally from Germany, which means, of course, that she speaks German and English, as well as many other languages. She'll tell you in a moment. And she's our language connoisseur here at Facialteam, and which is why she's so great at being the post-operative coordinator, because she can communicate with people from all over the world easily. So thank you so much for sharing the information here today, Sonja.
Thank you. Thank you so much for being here and joining us. And thank you for helping me out and moderating me. So really appreciate it.
My pleasure. So Sonja now forms part of what we call our comprehensive care department. And as I said, she's the post-op coordinator. So she's your contact for 12 months after surgery. She's in contact all the time via email to answer any of your doubts. And she'll talk a little bit more about the specifics that are in our post-operative patient guide.
Okay, so I take over, I do that. So thank you again very, very much for joining us. As Lilia said, I'm Sonja. I'm the coordinator from the postoperative department. We have a postoperative department because here at Facialteam, we believe in the importance of still being there for the patient, like really face to face in an easy way of communicating. Once they have finished their time here in Marbella after the surgery, after the first post-op period.
Sonja,
tell me.
We have the same problem as before. So I'm going to restart on Facebook. Okay. So just 1 second. We're recording here in Zoom anyway, so if we have to, I'm just going to now restart it, share on a page, and I'm not going to do the new version, which is crap, because it does this, it just stops. So we're restarting. It seems it is live, Gabriel says, but my screen came up that it stopped. It says the live has ended.
Oh, I love live connections.
So I'm going to restart. I'm not going to use the live producer, which is the new thing. And post-operative guide. Okay. Go live. Okay, we're reconnecting. Zoom is connected with Facebook now. Yes, Gabriel, start it again. And delete the old one. Delete the old one. We'll start over.
Okay.
Okay, so we're back. Sorry about that, folks. Facebook seems to have a glitch and it just randomly ended our live stream. So we'll begin again. Hello, planet Earth.
Yes.
It's my typical opening. I hope all of you are safe and healthy in these times. And welcome to our webinar about the post-operative guide. And I have here today Sonja Rehr, who is our post-operative coordinator. And I'd just like to introduce myself quickly. I'm Lilia, and I'm the community manager for Facialteam, and I've been working with the trans community for over a decade now. So thanks for coming to, again, one of our lives, and we're just restarting again since Facebook has kicked us off, but we're going well now. So Sonja, I'll give a little history. It has been with Facialteam for 4 years now, starting out as a patient coordinator, and most recently is now the postoperative coordinator, which is part of the comprehensive care department of Facialteam. So very important, because she's your person for the year after surgery to contact. So she's the one that's replying to all of the patient's emails with any small, tiny little doubt that you might have during the 12 months after surgery.
And more.
And sometimes more.
And more. If it's necessary, also more.
Sonja, who we can see is very fluent in English, but she also speaks how many different languages?
Well, I live in Marbella. You learn languages living in Marbella. I'm actually from Germany, so German, obviously. Spanish, because we live in Spain. And then I managed quite well in French and in Italian, which I actually taught myself. So it's basically full of mistakes, but I actually make myself understood. It works.
So Sonja, with her talent for languages and communicating, is the perfect person to be our post-op coordinator, because she's able to communicate adequately with people from all over the world. So thank you, Sonja, for being a language guru. And
Thank you so much.
And also one of the sweetest people that manages to really help a lot of our patients who have questions as they're recuperating after surgery. So today we're going to discuss a little bit about our specifically our postoperative guide, and Sonja's going to share a little bit of information in a presentation. So if you want to open the presentation, we can get going with that. Please, everybody who's here, while she's opening that presentation, make sure you tell us where you're from in the comments below, okay? We'd love to hear from you and know exactly what country you're coming from. And don't be shy. Please do ask us questions, and we'll be attending to those questions.
Exactly. Well, this is where you help me with, correct, Lilia? I'm going to just start with the presentation little by little, and if you see that any questions pop up, you're going to interrupt me whenever you want and just say, hey, there's a question from Sydney, wherever.
Yes, I'll jump in and interrupt you. Don't worry.
Great, perfect. So, yes, this is, well, as Lilia said, I'm Sonja from the Postop department. And we have created a postop department because here at Facialteam, we really believe in the importance of continuing by the side of our patients once they have concluded their time in Marbella. So until that point, everything has been organized, and the patient just like this, had to follow instructions. But once they finish their time here and the stitches are out, they had the final consultations and they're on the plane back, very often questions arise. Questions like, oops, I didn't ask, can I already do this? When can I start, I don't know, electrolysis again? When can I do sports? For all those things, we normally hand out a postoperative guide, which is what I'm going to be resuming today a little bit. But still, it often happens that there is little things which aren't mentioned there because it's impossible to address all doubts. And then also every person is different, the circumstances are different, and the doubts are different. So this is why we then, apart from that, have the daily contact or email contact whenever with the patients once they went back home. So this department is formed by Dr. Miguel Angel Julian, who's this handsome guy here on the picture, and myself. I don't have a picture of myself because, well, you're talking to me. Then let me introduce. Yes, so as I said, this guide is going to be there a little bit in order to address all doubts, and also it has instructions for the aftercare of the different procedures. So that means that if a patient only did, let's say, forehead surgery, the instructions are only going to be addressed to the forehead surgery, and then also frequently asked questions. We also include them always. Let's start with that then. The post-op kit always entails general information and the different phases during the recovery, specific information regarding the procedures, and specific instructions for each procedure. intergeneral information, the different phases, that's quite important, because I always say that the difficult phase actually starts once you get back home. Why is that? Because you start feeling better. The first days after the surgery may have been a little bit rougher. The first night is not so nice. And then next day you're still very swollen. And then little by little you start feeling better. Swelling is going away. Bruises are little by little fading. And by the time that you're leaving Marbella, which is 8 days after the surgery, normally you already should feel quite okay. After one more week, you start feeling really well. And after the week after, many patients already have the feeling that they have recovered to quite a big extent, which is absolutely non-realistic. We're very happy that it is like that the recovery is not a very aggressive and difficult one normally. But it also means that expectations normally arise very fast to see the final results, which is normal. If I feel normal, if I don't see any bruises, oh, that means I'm healed. No. The phases explain a little bit how the inflammatory phase, for example, lasts minimum 6 months. That means during the first 6 months, you still have swelling. You still may have asymmetries. You may have some pains and itches and twitches here and there. You may have some asymmetries. You may have some not very even skin in some places, depending on the procedures you have. I will get into that afterwards, step by step. Once I start talking about the procedures, I'm going to start talking from the upper third of the face to the lower third of the face. Okay, so let's continue. That's a little bit the phases, as I said. So the early inflammatory phase is the first 4 weeks post-op. This is normally, depending also to the extent, depending on each person, you can look more or less swollen and it's visible to the eye. Then afterwards comes the late inflammatory phase, where the swelling, the deswelling actually slows down. The first few days and the first few weeks, you see how the healing goes really fast and you're like, wow, great. But then at one point it will start slowing down, which is also a thing where post-op department is very often required, because patients get uneased or something when they see that suddenly it's not going down the same rhythm at the beginning, and they start thinking, oh my God, this is going to be the final result, or this is still, I don't know, one eyebrow is higher than the other one. Those are things which normally always settle, and we can't actually even assess it at the beginning because there is a lot of swelling going down. And then the last phase is the tissue readaptation phase. This normally starts after 6 months slowly, but it can last up to a year or even a year and a half. This is especially interesting for example, after a jaw and chin surgery, because I will get to that, but there the tissues really need time to readapt. Here are a few examples of patients 8 days after the surgery. You can see there is massive differences in the swelling, in the bruising. Also, it's been different intervention procedures. So you can see one lady who has a lot of bruises, somebody else like down at the corner, there's no bruises after a week. So you can see every person is a world, every person is different. And you should never measure yourself with other patients that you've seen and saying, oh my God, why am I taking so long, or the other way around, because you never know, because maybe you have a patient who 2 days after the surgery is very bruised, and after 8 days or 2 weeks, there's hardly anything left. Or then it's the other way around, because you don't get easily bruised, but you also take time to heal. So that's just an example how every person is a world. That's something that I really don't get tired of repeating. It's very important to know that, and to just be calm and patient once you're back home.
Everybody heals differently, don't they?
Totally. Also, that's the same thing. Some people have a very low space for pain and they feel pain more intensely. Other people hardly don't feel anything. Some people are more nervous, other people are calmer, some are more patient, others are not. Others already had surgeries, doesn't matter whether in the face or anywhere else, and they know how they're healing, and they know a little bit that everything always gets better. Others didn't have that experience and maybe a little bit more anxious. This is why really I always tell patients, don't hesitate to contact us. I always prefer, please call, write, before you start Googling or asking other people, asking the neighbor for advice. I mean, we're here for you, and we love to be here for you, and really, any questions, always welcome. So
yeah, just especially now. Right now, if you have any questions, please do write them in the comments and we'll attend to them while
yes,
we're doing the presentation.
exactly. That's an email less. No, really, don't hesitate. Shoot away any questions. So, for example, the general information you find in the guide, in the postoperative guide, is general information about lifestyle, and then something that we call, or I call, a 6 weeks rule. That's the do's and don'ts at the beginning. Why 6 weeks rule? Because there's many things you can't do during the first 6 weeks. I'm actually going back. I'm so sorry. So
I love the 6 weeks rule.
The 6 weeks rule. Okay, let's go for it. What shouldn't you do for the first 6 weeks? Because actually the 6 weeks rule is all the things you should not do. It's don't go to the sun, avoid direct sun exposure, even more when you have bruises, but also when you don't have bruises, because heat and swelling are not good friends, meaning that actually the heat empowers the swelling and it takes longer to go away. Also, that means don't go to a sauna, for example. Don't do any sports. Don't do any cardio work. I mean, walking is lovely, but don't do jogging. Don't do anything that's making effort. That goes especially for patients who had a forehead surgery, which are the immense majority of our patients, because we want to avoid pressure also in this area. That's very, very important at the beginning.
I'm going to interrupt you for 1 second, Sonja.
Of course.
Because I want to play devil's advocate.
Okay, do that.
Some people would say that sex is a sport. Do you consider it this?
Oh, well, that's actually quite personal almost. No, joking aside, I would answer vanilla sex. I mean,
gentle.
There's sex and sex.
Low impact.
Sports. I mean, I would just say, take it slow, and that's it. I'm not going into any further things, but I didn't prohibit it, okay?
That's good to know.
That was a good one.
We do have a question here.
Okay.
It's about underlids. Underneath
eyelids. Okay.
They said underlids, but I think they mean the underneath the eye. The area is still swollen over a year after surgery. Is that typical?
No, it's not typical. I would actually ask in this case if it was possible to send me some pictures to the post-op email address, explaining a little bit if it has gotten better, when did it stop, and then pictures, good pictures, and I will talk with the surgeons, show it to the surgeons, to Dr. Julia mainly, and then get back to see whether it's still some residual swelling or if it's loose tissues, if it's something that can be done just by external treatments, or what options you would have. Please, so really, send me some pictures. Tell me since when it hasn't moved. It means like until what point you felt that it was improving, and when did it stop improving. Also, if it feels tight, if you touch it, if it's swollen somehow, or if it's just like a dark circle. The more information, the better. And I will definitely get back to you with options and answers.
I've heard that the dark circles sometimes take quite a longer
yes,
time.
And if you have fair skin, normally it can take longer. Then it depends a little bit of age as well. There's many factors which can also make influence on that. But you mentioned swelling, so I don't know if it's swelling. I would really, if there could be pictures, some good pictures, and explaining a little bit also how it feels to the touch, that would be great.
Great, okay. Thank you, Sonja.
So I will continue. In sports, I also include a little bit things like yoga, and you can stretch out a little bit, always careful of not bending the head down, which is another 6 weeks rule. During the first 6 weeks, try lowering the face in comparison to the heart, meaning no inverted positions. Also, if you have to tie your shoelaces, try to keep the head up when you do that. You will actually feel in the moment you bend your head, pressure rises, and this is this feeling where we would say, try to avoid that. And then laser and electrolysis, waxing, depilation. for 6 weeks after the surgery around the surgical areas, meaning that if you, for example, had a forehead reconstruction, wait for 6 weeks before you start plucking your eyebrows. If you had chin or jaw surgery, wait 6 weeks minimum before you do the electrolysis or laser treatments. Why is that? Because those are treatments which normally create inflammation. You are still struggling and fighting against inflammation, so it's counterproductive. So that's our recommendation, waiting 6 weeks there. So now we start talking about the specific procedures. I will start from the upper third and then just walk down. So the highest procedure, so to say, would be the hair transplant. The hair transplant is a technique that we very frequently do simultaneously with the forehead surgery, because it can be done at the same time, and that's marvelous. I'm not going to start explaining how it's done, but hair transplant. So patients who had the hair transplant will find in the guide information about the growth rate, and then instructions of how to wash the transplant site and how to take care of the transplant site, a little bit what to expect, and frequently asked questions. So here as well, we have the 6 weeks rule for sun. Although we always recommend try to avoid the sun for the first 6 months, at least in the extent of not getting a sunburn on the area. So really protect the area. It's like little babies, they have just been placed there, so take good care of them. Regarding the growth rate, the most important thing, I'm just going to mention it now, is that during the first month, the hairs fall out. At the beginning after the transplant, they start growing a little bit and suddenly they start shedding. This may happen symmetrically or asymmetrically. And this is something that scares patients. Even if we say it, very often they write and say, hey, Sonja, it's only 2 weeks after the surgery and they're already starting to fall out when I wash them. It's normal, they have to fall out. The follicles are there, they're rooted, they're under the skin. And depending on the phase they're in, they take a little bit less or more time in order to show up again. Normally that happens up from the 3rd month. So up from the 3rd month, growth can be expected. And then instructions and of the washing of the hair transplant, for example, like during the first week while you're here in Marbella, you should not touch the transplant site. You will get those instructions from your coordinator, and also a nurse will explain it to you, the doctors will explain it to you. So, but during the first week or the first 6 days, you're actually only vaporizing saline solution and then some disinfecting solution on the area, but without touching it. After 6 days, you would get the first washing. Therefore, you would come to the hospital, a nurse does it. And then from the 8th day, which is actually the day, or the 9th day when you're traveling back home, you can continue washing it on a daily basis. And the instructions are in the booklet on how to do that. It gets easier and easier and easier, actually. Then what does the guide entail as well regarding the hair transplant? Frequently asked questions like itching skin that can happen because due to the swelling, because you had a lot of swelling, then the swelling goes down, this dries the skin. It may give you itching and even some scabs like some dermatitis. All those questions are addressed briefly. Maybe the answer is enough. If not, again, email to postop@facialteam.eu and then we can have a look at it. Again, sending pictures is always very, very good, because like this, the hair team can also evaluate it and say, in your case, we recommend this shampoo, or don't wash it too often, apply some olive oil. Don't take notes now because olive oil is not for everybody. So that's also very, very important. There's no rule, one rule for everybody. Like every case is different. We continue down. After the hair transplant, we go to the forehead surgery. So for the forehead surgery, the 6 weeks rule is extremely important, as I said, because we want to avoid the pressure and tension on the operated area. So for example, after the forehead surgery, you should not blow your nose. If you have to blow it, really do it very gently without any pressure, one nostril, the other nostril. Use irrigations with saline solution in order to, if you have the nose blocked, that will help a lot. But don't put any pressure by hardly blowing into the nose. Having said that, same goes for sneezing. If you have to sneeze, you can't avoid that. So just mouth open. Don't avoid pressure by closing the mouth and partially trying to sneeze like this. It's not desired after the surgery. So just if you have to sneeze, sneeze normally.
What about using a straw?
How about using a straw? Well, sometimes patients prefer to use a straw because they just had like chin and jaw surgery. There's no problem, although for the forehead surgery, I would prefer if they drink out of a glass, or if they use a straw, at least that it's not very thick liquids, that you don't go too hard. I'm very exaggerated, sorry for making those faces, but I think it helps to understand it a little bit. So yes, you can use a straw. That's no problem. Just really try not to use pressure, which could happen with a big fat smoothie and a small straw. That's maybe the combination I would avoid, or we would recommend to avoid. Then I mentioned before the eyebrow plucking, 6 weeks after a forehead surgery. Hair coloring, 6 weeks after a surgery. That goes because of the scar that you have. Give it time to recover. You get the stitches out after 8 days. And then it depends. Some people already have a beautifully clean and dry scar. Others take a little bit longer, but still it's tender. So we always say 6 weeks before you start dyeing, and before really using abrasive products like straightening products or dyeing it white or really blonde or something, I would even wait 2 months after surgery. Then in the guide, you will also find frequently asked questions. Frequently asked questions, they vary a lot. Many answers and questions don't apply to all patients, but it's just a mixture of questions and answers we've put in there because it's things that come up very, very often, like itching, as I said before, or then like a little bit of pain when you touch here and here, where people think it's a pimple or a bump that suddenly has showed, which could be the endotines. Not everybody gets them, but once the swelling goes down, it's something that can give those symptoms of feeling like hard to touch, and it's like a pimple. People start touching it, then it starts hurting even more. Endotines are like teeny tiny devices. People who had surgery and who had them will know. And they're like little anchors which are underneath the skin, and they're self-dissolving. After a few months they dissolve, but there is a space of time, a period of time after the surgery, like normally it happens 2, 3, 4 weeks after surgery, when some people notice them. And then, for example, well, our recommendation there is please don't touch it because you irritate the skin. Then dermatitis, I mentioned it before, can happen after the swelling, when the swelling goes down. All those questions are included in there. Okay.
Yeah, the horns are a very common question, even though people are given all this information before in the preoperative consultations in their guide. They get a guide when they come.
Right.
And a lot of this is explained as well, but still, you know, it's nice to have a coordinator that's on hand by email at all times to answer all these little doubts.
Totally. Also, because even if we try to give out all the information or as much information as possible during this day, it is so much information that a part always gets lost because you're nervous, you're just about to have surgery, or you just had it and you're tired. So it's completely normal that those questions pop up afterwards as well. So yeah, the horns are quite frequent, although I have to say that the techniques are always getting better and better and better, and the devices are getting smaller and smaller and smaller. So actually it's changing there as well, but still it's a frequently asked question, yes. So if there isn't any questions for the forehead, I walk down and we go to the, well, in between. As for the forehead surgery, we didn't have any scar instructions, any scar care, because this scar here, as it's hidden in the hair, doesn't need any specific care instructions. I will now get into the care instructions because there's other procedures up from now which will need that. So as you can see, there is a cream. Well, it's a gel. It's called Dermatix. It's something that we recommend. It's a silicone-based gel for scars. And then a little oil, which is rosehip oil or rosa mosqueta oil or rosa damascena oil, which we also recommend. And then sun cream. That's like the most important thing of all, I would say, in the month after surgeries. Now, I'm not talking about the days after surgeries. I'm talking really about the month after surgeries. So the oil, the rosehip oil, or the, rose oil, let's call it like that. We recommend that the patient start applying it 1 week after the suture removal on the area of the scar. External scars, like, for example, after a rhinoplasty, lip lift, trachea shave. Those are actually the treatments where they apply it. And then the dermatics, another week after. So that would be 2 weeks after the suture removal. And the sun cream for sensitive skin, very high factor, and make sure that it's a new one, that it's not an old cream, almost since the beginning. And the moment you see that the scar is dry, start applying it. Avoid the sun by all means, because a scar takes 1.5 to 2 years to be mature. And that time it's extremely sensitive to get pigmentation, decoloration or pigmentation problems. So the sun protection helps with that. Having said that, let's move to the first treatment, which has scar instruction, which would be the blepharoplasty. It's an upper eyelid correction, which in some patients also is done during the FFS surgery. So here it would apply the scar care instruction as mentioned before. First the oil, then the dermatics, and always sun protection. At the beginning, it might create a little bit, the blepharoplasty might create a little bit of photophobia. And then also you have the scars. So we deeply recommend to wear sunglasses whenever you go out. It will help you, it will ease you, and just it protects the scar itself. There's not so much more to say about the blepharoplasty. So we continue down to the rhinoplasty. Rhinoplasty is a very frequent procedure in FFS surgery. And even more, once the forehead surgery is done, very often a nose that maybe hasn't been very prominent before could stick out even more. So it's very frequent. Rhinoplasty is done normally open. That means you will have a little scar here. On that scar, it goes the same instructions as mentioned before, with the oil, the dermatics, and sun protection. Then, as you're not blowing your nose, well, neither because of the rhinoplasty, you wouldn't want to do that. And then after the forehead surgery, we also don't recommend it. So irrigations with saline solution, you can do them up from day 1 and indefinitely. Only saline solution, don't use any kind of menthol, eucalyptus. Many patients ask that. Just plain saline solution in order to keep the nostrils moist, clean, help releasing the crusts. And also you have, for this procedure, normally you have reabsorbable stitches inside the nose, and the irrigations help also to keep them clean and even to dissolve them earlier. Another thing which can be done, although many patients are afraid to do that, but we always say that they shouldn't worry about this, is a very gentle massage. Take a moisturizer, because the nose is a procedure which takes very long time to heal completely. Like a forehead surgery, after a month, you already see a beautiful result, after 2 weeks even. Forehead surgery, the nose surgery takes longer. Very often this part here looks extremely white afterwards, and then it's like a big worry, like, oh my God, my nose looks whiter now than before. The tip of the nose may be white, it may be a little bit asymmetrical. And then also, when you touch it, it's very tense to touch.
Sonja,
Therefore,
sorry to interrupt. Do you ever get asked how to make saline solution?
No, actually not.
I suppose people look it up themselves. I just also wanted to mention that one of our nurses is watching right now. Is Steffi. Thank you for coming and watching. And Steffi, let us know if you think that Sonja should discuss anything more specific in detail.
Yes, please. Oh, it's nice that you're there.
Yeah, Steffi, Curra, Carmen, we've got a few people from the team here.
That's so nice. Hi.
Leanne, I don't know if you remember Leanne.
Oh, of course. Hi, Leanne.
Rebecca.
Oh, it's so good because I'm a little bit blind here. The only thing I see is my presentation, Lilia and myself. So I don't know who's getting in here or not. Lilia's at my eyes at the moment.
Yes, there's some people here listening in. Rachel, Sarah, Eva, Livia. So I'm sure some of those names ring a bell with you.
Oh, yes. Hi.
Yes, so
So,
Steffi, let us know if we should discuss anything in particular, since you're one of the nurses that does the daily visits of our patients when they've come out of hospital and they're staying at the Lilia perhaps, and our nurses go every day to check on patients. So we'll be happy to cover something that you think is important.
yes, totally. So going back to the massages. So do massages. Don't be afraid to touch the nose. Do them gentle at the beginning. Do them extremely gentle. And little by little, you're going to feel that it's actually not painful. And even more, you're going to feel so relieved after doing that. So there is in our YouTube channel, there is a section with a video for post-op care instructions of the nose. Have a look at it. It explains a little bit on how you can touch and drain the face. Also, there's another one about drainage massage. Both of them are extremely helpful, and I really recommend them. So moisturizer and touching the nose very, very gently, just stroking. You can also tipple it. You will feel really how after when you finish, there is a big relief. And then also on long term, it will help to settle the swelling a little bit earlier.
Yes,
Frequently asked questions about the, tell me.
the video, I wanted to mention the video that we have, which Sonja is featured in. It's about caring for your nose after the rhinoplasty. It's quite good.
Please don't look at myself.
We'll put a link now to that video.
Do that. Frequently asked questions about the nose, actually just pointing out two. One of them is asymmetries after the surgery, which are very frequent due to the swelling. And as the nose is in the middle of the face and it's just there looking at you every time you look into the mirror, it's something which is not very realistic at the beginning. So I always say, please be patient, give it time to settle. Normally, after 6 months, we can start seeing whether everything is going to the right direction or not. Before that, it's almost impossible to evaluate or assess anything. So here, really, patience. We are here. So if there is anything, we will be there as well. We will always be there to give you different options and to evaluate it. But really, it's the most difficult step, as I said before, those few months where the swelling is still there and it plays tricks on the nose. So time is needed there. And the other question is bad smell, because there is reabsorbable stitches inside the nose. Those stitches, they can either fall out or they little by little melt and then turn into some kind of silicone and then come out. That can give a very bad smell, like similar to some patients who don't know it, they think that they have an infection. It's not an infection, it's the stitches reabsorbing. So therefore also irrigations help. And the smell, you're going to be the only one swelling it. Nobody apart from you smells it, but you have it inside the nose and it's not dangerous. Anyhow, if you would feel that there's seed, fever, redness or something, don't hesitate to write, because maybe it's not the stitches, but a sign of, for example, a stitch that got infected or something. Let's continue. The next procedure is the lip lift. Lip lift, if performed at the same time with the rhinoplasty, it would have the same scar, meaning the rhinoplasty scar would be the same one as the lip lift scar. That scar is a little bit bigger. It's underneath the nose, and it's the only scar from our procedures which could be kind of visible even after healing, which is why it's extremely, extremely important to follow also the postoperative instructions, which are applying the oil, the dermatics, and the sun protection. How long? Frequently asked question. Minimum a year, 2 years, even better for the sun protection. The dermatics between 3 months and a year as well. That will help you to keep the scar flexible and to avoid that it sticks out somehow. And then also the massage does good. It encourages the circulation and yes. And then at the beginning, also another recommendation, important one, avoid excessive stretching of the area. Meaning laughing is wonderful, but for the first few days, maybe the first 2 weeks, avoid smiling too much or going like this. Like for example, if some patients, they still have to shave, don't do this movement of shaving, avoid shaving, by the way, for the first weeks. because as it's also reabsorbable stitches and they are internal stitches, in order to protect them. Give it time to settle by its own. Frequently asked questions here is, for example, that it seems that the lip is dropping again. That's normal because at the beginning, it's a little bit more exaggerated than the final result is going to be. Depends very much on the flexibility of each person. Normally, we always overdo the lip lift a little bit because we count on that afterwards it's going to settle. Sometimes the patients even liked it better at the beginning, but it's not a natural result. It will little by little come down a little bit. Also, when the swelling goes down, it will look as if it came down a little bit more. That's actually everything for the lip lift because it's quite straightforward. And now, jaw and chin surgery can be done together, or sometimes only the chin is performed. For both of them, the stitches are inside the mouth. That means there's no suture removal, and the stitches also reabsorb little by little alone. So for example, one thing that you will find in the guide is instructions, hygiene instructions. You already started doing them actually while you were in Marbella. The on-site coordinator has already explained them. The doctors will have said it, and I will repeat it again, and I do so now as well. Meaning, directly up on the day after the surgery, you will get a little toothbrush. It's smaller and it's softer than a normal toothbrush, and a mouthwash. With the toothbrush, don't doubt to gently brush the incision area. Why is that? Because we can also get plaque and residues on the incision area and on the stitches, and you have to avoid that because it would be a potential place where you could get an infection. It normally doesn't happen because our patients are really following the instructions and very seldom, but really it's something you have to take care, and after every meal, brush the area. And afterwards, the mouthwash, you get the mouthwash while you're here in Marbella, and then another one before you leave, which is a maintenance one. It's a little bit softer. Also after every meal, use the mouthwash, rinse the area of the incisions. Stitches fall out around 6 weeks after surgery, but sometimes it happens earlier. Sometimes it takes a little bit longer, until 10 weeks or something. If it happens earlier, there's no reason to worry because the mucosa closes and heals very, very fast. So even if suddenly the stitch falls out, if you see that it's closed, there is no worries. I haven't had a case until now where it stayed open, or nobody wrote to me saying that. So there's no problem either if that would happen. Just have a look that it's clean, that it's neat, that it's closed, and that's okay. Smoking. Smoking is one of the general instructions that you will find everywhere, that you should not do that. Not before the surgery, not during your time in Marbella, and not after the surgery. After any surgery, it's not good, but even more after a jaw and chin surgery. Just imagine the smoke touching your incisions. I think just imagining it makes it understandable that no good. And here, as a personal comment, if you have already not smoked 3-4 weeks before the surgery and minimum 6 weeks after the surgery, don't start again. Also, chin strap. You will get a chin strap while you're here in Marbella. During the first week, that chin strap should be worn almost 24 hours a day, as much as possible, because it helps a little bit to keep the swelling in place, and then also it helps with the readaptation of the soft tissues. Once you leave Marbella, which is the moment that the post-op department really shows up, you should continue wearing it for another 3 weeks, but only when you're resting, watching television, lying down and sleeping. If you go to work, don't wear it. If you go to a restaurant, don't wear it. If you don't go to work and you're the whole day at home, do as if you were working. Don't wear it the whole day. Make long breaks. Why is that? Because as I said at the beginning, we wanted it to keep also the swelling in place, but the swelling is now, after in the second week, already going down by its own. The body is healing and it's doing that job already. So when you're wearing the chin strap, and sometimes also quite tight, it actually stops the natural process of liquid drainage. Also, it avoids that you articulate loosely, which is very good that you do. We encourage you to articulate because it's some kind of movement to the area, and that helps draining the area. why do we want you to wear it anyhow still for a certain time? Because of the readaptation of the soft tissues. Now the swelling is little by little fading. Also, bone has been taken away. That means that suddenly your skin may be a size too big, to somehow to say it. So the chin strap is there. It shouldn't be squeezing, just holding. It's there to show the skin the way to the new bone structure. Somehow, yes. So do that for another 3 weeks, and after that, it's not necessary to wear it any longer. That's a very frequent question. Hey, is it helpful if I continue wearing it? No, it's not proven that it's helpful to wear it after 4 weeks. After 4 weeks, you're through with it. Any questions? Nope.
About the jaw and chin surgery? Not at the moment. Please let us know if you have some questions. Just write them down into the comments below the video. And we'll be happy to attend to them as we're talking. And also remember to let us know where you're from.
Yes. And then frequently asked questions normally after a jaw and chin surgery are related to numbness. Normally there is quite a big numbness in this area the week after the surgery still, and then little by little this fades. Some patients it takes a little bit longer, and some even after the week they already start feeling something, but it's normal to have it. It will come back. The nerves have been stretched extremely. There has been worked around it, but due to the technique that we're using, they are protected. The nerve branches are protected, and also the soft tissues. But it just needs time. When the swelling also goes down, little by little, the sensations come back to normal. And then another frequent, sorry?
That's a question that a lot of people ask is, do they cut my nerves?
No, the nerves are not cut and they're actually protected. You can see it before the surgery. We always do a CT scan. You see where the 2 nerve branches come out. And yes, they are protected and not touched. Also, a technique that the surgeons are using is ultrasound technique, piezosurgery and ultrasound technique, and that cuts the bone, but it doesn't cut the soft tissues, meaning no muscle, nerves, etc. Another question which could show up and which is also relatively frequently, even more in surgeries where a lot of bone has been removed, is loose tissues and submental, like under the chin. It cannot always be avoided. Also, it means when you take bone away, yeah, the skin has to readapt. Then it depends on the quality of the skin, of the age of the person. Also, if there is weight changes after that. So again, it's a different world. Every person is a different world. It takes quite a long time to readapt their tissues sometimes, because at the beginning you will see like a little bump, like swelling, and then afterwards it may even get soft. Give it time. That's normally minimum 6 months, and actually then the skin readaptation starts. Swelling will disappear by then, but the skin may take a year or 12-14 months to completely readapt.
I have a question in the group that's not related to jaw, but because we already talked about the mid face, and actually you didn't touch on the malar surgery because it's something that isn't done that frequently. But the question from Diana in the group is a reduction Blepharoplasty. Blepharoplasty would be to reduce the cheek. Should it be done by a head, neck, and maxillofacial surgeon or by a craniofacial surgeon? That's a difficult one, eh, Sonja?
It's a difficult one. I know that I do know that what we do is the Bichat surgery, which is taking the fat pads, the buccal fat pads away. Normally, I haven't heard about cheek surgery of taking it away because most of the patients always aspire to have bigger cheeks. That's like normally the biggest desire is, please give me cheeks. I've never heard so far that somebody would have wanted to take the cheeks away. I would have to consult that and get back.
Exactly.
If you want, write me an email, although it's not totally post-op, but I will give it forwarded to the surgeons and also be happy to get back on that.
Also, the titles of surgeons is different according to the country. So here in Spain, I think a head, neck, and maxillofacial surgeon is the same as a craniofacial surgeon. So it's to answer the question in regards to what kind of professional should do this kind of surgery, I would say consult with a maxillofacial surgeon in your country and with a few of them and see what they say.
Yeah, that, and then also always the option of writing to us and we check it out, because now, for example, I'm post-op, it's not a procedure that I have heard of. I don't know whether we're talking about bone, if we're talking about soft tissues. So, but it's an interesting question. So yes, please also ask us like by written and I will be happy to get back, or my colleagues will be happy to get back to you. So continuing going down, we would still have the Adam's apple, which would be the tracheal shave. In our case, we never do the cut on top of the Adam's apple, but we do it hidden somewhere down here, and it leaves a very small scar. Still on that scar, it would go the same scar care instructions. A week after the suture removal, the rose oil, and 2 weeks after the suture removal, the dermatics, and always, always, always sun protection. Minimum during the first year, for me, even longer. Frequently asked questions there. There's not so many. Sometimes that the scar gets red again. Yes, that can happen because the scar takes many months in order to be mature. So it may even fade at the beginning and get flat and whitish, pale, and then afterwards kind of reactivate, getting a little bit red and bigger again. It's normal. It happens to scars. They do that. But even more important, continue using the sun protection. And then another thing is the swelling here, and even more in patients who are a little bit slimmer or have a skinny neck. When at the beginning, the swelling is everywhere, and then little by little, it gets like a little bit more closer to the middle, and it may feel as if you had bone here. It's not, it's a different kind of swelling. It's the tunnel that has been used in order to access that may create a different kind of swelling, a little bit more localized, and it just needs more time than the other one. About the trachea shave, there's not so much more to say, actually. Here, I'm talking still a little bit about...
I have a question.
Tell me.
I don't know if you touched upon it. Sorry, I was just writing your email. Somebody was asking for your email. And they called you Dr. Sonja. We just want to clarify. Sonja's a coordinator. She's not a doctor. But if she needs the information, she always consults with our team of surgeons. But I wanted to mention about the trachea shave or tracheal shave or Adam's apple reduction. It sometimes looks worse before it looks better. Is that right?
Yes. Yes, because of the swelling. And normally the Adam's apple is a little peak. But of course, after manipulating the whole area swells. And then comes the swelling that I was just talking about, is when this big swelling goes away, like the one which I call like a blurry swelling, and it gets suddenly like more specific in a specific area, and then it marks the tunnel like this, and then it seems suddenly as if everything was bigger than before, which obviously is bigger, but it's swelling. It's not bone. We haven't put any bone in there, but the bone has always been taken away, and it's swelling, and it just needs time.
Exactly.
So some other procedures that I would like to mention, which are a little bit more optional and additional, and it's not bone related, is the facial lipofeminization, which is also called FLF briefly, which is a fat grafting that is done by the own patient and then put in different parts of the face. Normally it's mid-face, it can be put, and also upper lip very often, or lips in general. That's a procedure which has a nice effect on people who are a little bit slimmer, like similar face to mine, which has a lot of angles, and some patients don't like that, some women don't like that. It gives a little bit more of fullness, roundness, and makes softer in general. For there, you also have the scar care instructions, which is more for the donor area, because it's the fat is grafted either in the belly or maybe in the glutes or thighs. And there you will have also a little reabsorbable stitch, and there you can use the oil and the dermatics as well. And then in the face itself, you don't have any scars, you don't have any stitches. You would have like maybe a little point of where it has been injected, but nothing else. Important as well, as it can create swelling, it can create some bruising. Careful with the sun, but that goes for itself, like with all the other procedures. And this has been everything. There's no more procedures specifically to talk about. This is our team. The picture is not the newest one, but still we are more or less the same team. Me, I'm not on that picture, by the way, so I'm here. And we are all here to help you. So even if we have a post-op department, if the questions cannot be solved by one of the members of this department, all those people who you see on that pictures and even more are there to give their expertise and point of view. So if you need something from the hair team, I address the hair team. If it's something specific for aesthetics, I talk to that person, like, or the nurse. So we're all here for you, by your side. There's now finally my picture. That's me, Sonja. My email address, postop@facialteam.eu. And really, please don't hesitate to always write when you need anything.
Fantastic, Sonja. And please, anybody, if you have a question, we're coming to the end at this point. So please let us know if you have any questions regarding the postoperative guide for patients. That was fantastic, Sonja. It was a very thorough, all-round description. And this is the kind of briefing that our patients get with Sonja before they leave Marbella. Is that correct?
Correct. And then it's even easier because it's face-to-face, and then normally you can always answer little doubts which almost always arise. So it's a little bit more interactive than this one now, but yeah, the guide is basically this one. It has more information than I just mentioned, which would be impossible to go through every detail. But basically that's the briefing, exactly.
Exactly. This is the abridged version, the actual guide, which you also give to them in print, correct? It's a little pamphlet.
I can also send it digitally, and I give it out in print.
Fantastic. Wow. Thank you so much, Sonja. That was really, really good. I just want to ask everybody here to please share this video with their friends who may find it useful, who are researching FFS surgery at this point and are feeling a little bit unsure about the post-op period, and because this video resolves a lot of doubts. Also, remember to come back for our other live events tomorrow, and on Thursday we'll have Dr. Capitan and talking with everybody here again on our fan page. So please come back. He's going to share some news and about Facialteam and the future, and it will be in Spanish, en español, el jueves. Vuelve este jueves para escuchar Dr. Capitán hablar de la noticia de Facialteam aquí en este fanpage de Facebook. So, thank you everybody, and don't forget to join our newsletter. There's the link down in the comments. Click, join our newsletter to keep up to date with all of our upcoming lives and scientific publications and other events. Thank you so much for listening. I hope this has been useful for you. Let us know your comments, what you'd like us to talk about, if there's anything different, or where you would like us to talk about it in live. Please let us know. Send us an email or just comment in our videos. Thank you so much. And we're doing this because you matter. Everybody, you matter.
Thank you. Thank you for joining us. Bye. Bye, Lilia.
Bye.